Today, we're going to be talking about the symptoms of irritable bowel syndrome, or IBS for short. And I just want to throw this out there that I feel like the person who named the condition irritable bowel syndrome clearly did not have irritable bowel syndrome, because every time I'm experiencing an IBS flare-up, the last thing I'm thinking to myself is, my bowels feel just a little bit irritable right now. No. When I go through an IBS flare-up, I feel like my bowels are pissed off. They are angry at the world. And it's almost like this gaslighting session, even hearing the name irritable bowel syndrome, because the connotations of that are almost like it's this mild annoyance, which could not be any further from the truth. So the objective here today is to talk a little bit more about what the IBS symptom experience is. And it's really important to do that because IBS is a condition that is diagnosed based off of symptoms as opposed to tests. And so it's good to get a handle on what it is that are those core symptoms that you need to have in order to have an IBS diagnosis. Now, I do want to point out that there are so many different conditions out there that can overlap with different IBS symptoms. So if you're having some different GI symptoms, definitely pause and schedule an appointment with your physician to see what's going on, because it's possible it could be something else that's not IBS. But for the purposes of this video, we're going to be covering, for one, the two different core symptoms that are required to get an IBS diagnosis. And then we're also going to talk about some other symptoms that commonly happen in IBS, but that aren't required for the diagnosis. So to start out, I think it's best that we talk about the two core symptom criteria that are essential to have an IBS diagnosis, meaning that everyone with IBS has these symptoms to some degree. And the symptom criteria when it comes to diagnosing IBS is called the Rome-4 criteria, which comes from an organization called the Rome Foundation. So per the Rome-4 criteria, to qualify for a diagnosis of IBS, you must have recurrent abdominal pain on average at least 1 day per week in the last 3 months, associated with 2 or more of the following criteria: related to defecation, associated with the change in frequency of stool, or associated with a change in form/appearance of stool. And these criteria have to be fulfilled for the last 3 months with onset of at least 6 months prior to receiving an IBS diagnosis. Now, if you were listening closely there, you probably caught those two core symptoms that are required to have IBS, and those include having abdominal pain and some form of an altered bowel habit experience. Now, when it comes to abdominal pain in IBS, I think something to understand is that the nature of that pain is chronic and recurrent. It is not some one-off acute experience. It's something that is happening at least 1 time per week. And while abdominal pain can happen anywhere in the abdominal region, I suppose, with IBS, more commonly, people with IBS experience pain in the lower abdominal region, I guess you could say. And it's not a type of pain that is easily pinpointed to a singular location. It's more diffuse. So someone with IBS might describe their abdominal pain by using an outstretched hand to show the location of where they're feeling the pain. Now, when it comes to the intensity of the pain that's experienced in IBS, that can vary from one person to the next, but it is possible for it to be very intense at times. Just to give an example, I have a friend that has very severe IBS, and she has had an IBS since, high school age. And she was telling me about how there was this one time in high school when she was sitting through a statistics exam, and her abdominal pain became so severe to the point where she was concerned she was going to black out. So again, I think it's just so important to emphasize that when it comes to irritable bowel syndrome, it is not always some mild annoyance. In many cases, it can be truly debilitating and challenging to get through.
Before we continue, I want to quickly tell you about IBSprobiotics.org. So this started out as a research project, but then we ended up turning it into this really cool comparison tool. When you go on the site, you can easily compare which probiotics were most effective for different IBS symptoms, all exclusively based off of clinical studies. In fact, we spent the past 2 years building it, having analyzed over 50 different probiotics across more than 75 placebo-controlled trials. And the results surprised us. For example, we found that some really popular probiotics were nowhere near as effective as some lesser-known options, and there were even some probiotics that seemed to do more harm than good. So I hope this free tool helps you to cut through the marketing hype and saves you a ton of time when evaluating a probiotic.
Now, along with abdominal pain, that other core symptom feature that we see in IBS is altered bowel habits. And that can look like altered bowel movement frequency, which could be anything like having 3 or more bowel movements per day or having 3 or fewer bowel movements per week, for instance. It can also look like a change in stool form or appearance. And that is something that we measure using a tool called the Bristol Stool Scale, which we'll put on the screen for you here. And basically, this is just a tool that categorizes stool form into 7 different types, with types 1 and 2 being indicative of constipation, types 3, 4, and 5 being normal stools, and then types 6 and 7 being indicative of diarrhea. Now, as many of you may know, IBS has 4 different subtypes that it can be categorized into based off of the predominant altered bowel habit. So there's IBS with diarrhea, which is also called IBS-D, IBS with constipation or IBS-C. Then there's IBS with mixed bowel habits, so both constipation and diarrhea, and that's called IBS-M. And then there's IBS unspecified or IBS-U, and that's when the symptom criteria for IBS are met, but the individual's bowel habits can't be accurately ascribed to one of the other subtypes. Now, we're not going to talk about IBS subtypes too much here today since we have videos that we've dedicated to different IBS subtypes elsewhere, but I do want to point out that identifying your primary bowel habit is an important part of the whole IBS diagnostic workup and sorting out your subtype, because that helps to sort out what the most appropriate treatment is for your particular IBS case. Now, let's move on to some other common symptoms that are experienced in IBS that aren't necessary for an IBS diagnosis, like abdominal pain and altered bowel habits. And I think 2 that are really notable would be bloating and distension. I personally have a lot of bloating issues myself. It can be really challenging. And contrary to what you might think, bloating and distension are not the same thing. So bloating is more of a subjective sensation. So it's almost like this feeling of having a balloon inflated inside of your abdomen, right? Not comfortable. Whereas distension is a measurable finding. So it's when you can actually measure an increase in abdominal girth. And one thing that's kind of interesting is that bloating and distension can co-occur at the same time, but about half of people that experience the sensation of bloating have measurable distension. So it's not something that always goes hand in hand. Some other intestinal symptoms that are commonly reported in IBS are things like defecation urgency, probably one of those IBS-D kind of features. You know, that whole experience of sitting in rush hour traffic and then all of a sudden it hits you and you realize you have to find the closest gas station bathroom possible and hope to God it's not occupied and that they don't make you ask for a key when you get there. Not speaking from experience or anything. And then on the opposite side of the spectrum, it's also commonly reported for people with IBS to have issues like excess straining during defecation, probably more of those IBS-C features, or someone with IBS-M that has constipation as well, or feelings of incomplete bowel evacuation, mucus in stool, and symptoms that are frequently exacerbated or induced by meals. But the list goes on. There are some other digestive symptoms that are frequently found in IBS, and those can include things like heartburn or early satiety, postprandial fullness, so just that really full feeling after a meal. Also epigastric pain, so that's upper abdominal pain, and then nausea is also commonly experienced. Now, I know it seems like I just keep adding to the list here, and I'm going to continue doing that because sadly there are other conditions or symptoms even outside of the GI tract that commonly co-occur with an IBS diagnosis. So for the sake of being thorough and painting the full picture here of the symptom experience, let's go through those. I'll try to be quick because it is quite the laundry list. So those conditions or symptoms that commonly co-occur with IBS that I was talking about can be things like anxiety and or depression, fibromyalgia, migraines or headaches, bad breath or an unpleasant taste in the mouth, chronic fatigue syndrome, chest pain and palpitations, fatigue, tiredness, dizziness, chronic pelvic pain, hot flashes, increased urinary frequency and urgency, temporomandibular joint disorders, sleep problems, breathing difficulties, including things like asthma or having a cough, neck and back pain, decreased sex drive, painful sexual intercourse, and muscle aches or soreness, just to name a few. Now, after hearing about all of the different symptoms that can be part of the IBS experience, I hope that it's obvious at this point that IBS is not typically just some minor inconvenience, that it can be truly debilitating and can lead to significant impairments in quality of life. Because think about it, IBS symptoms can interfere with every area of life, be it your work life, your social life, your romantic life. I mean, when it comes to things like your work life, absenteeism is going to be more common because you have these GI symptoms that are unpredictable or out of control. Or maybe you're at work, but you don't really feel present because you're dealing with these painful IBS symptoms. I've even had people with IBS tell me that they chose entire career paths based off of a career that would allow them to have the closest proximity to a bathroom at all times. And then on the social life front, it's common for people with IBS to feel stigmatized by loved ones or family members or even their own physicians when it comes to the experience that they're having with their symptoms, because people often just don't understand what it's like to have IBS. And then adding to that, it can be really hard to have a social life, because how do you go about planning a hike with friends when you don't know where the closest bathroom is going to be or when your symptoms are going to flare up? And don't even get me started on the whole romantic life side of things, because how challenging is it to have romantic life where you have intimate encounters with someone and you're also having these explosive GI issues and symptoms? Not fun, very vulnerable, and potentially very embarrassing, to the point where people may avoid romantic relationships altogether. Now, if this whole spiel that I've been on here has not been convincing enough that IBS symptoms are a force to be reckoned with, then just listen to a few different alarming statistics that I have for you from different surveys and studies in people with IBS. So, for example, one survey found that people with IBS would be willing to give up 15.1 years of their life, so approximately 25% of their estimated remaining lifespan, to achieve perfect health. And then other studies have found that people with IBS would be willing to take on anywhere from a 1% to a 10.2% risk of sudden death for a 99% chance of a cure. So I'm going to leave on that note. But if there's anything that you take away from this video, aside from just having an overview of different IBS symptoms, I hope that you are firmly aware that IBS symptoms are not all in someone's head. They are real and valid, and they are incredibly challenging to manage from day to day.
Thanks for watching this video. And as a quick reminder, don't forget to check out IBSprobiotics.org. We're really proud of this research project turned comparison tool that we've made. And of course, it is free and publicly available. And if you want to keep up to date with the latest IBS research, you can follow me here. See you next time.